Electrophysiology is taking care of the electrical problems of the heart. So there are people who are plumbers who take care of the arteries and so forth, and we take care of electrical problems, whether it be a short circuit, a fast heart rate, a slow heart rate. Atrial fibrillation is a very common problem. It affects about 3 million people in the United States, and basically it's an irregular heartbeat in the top chamber of the heart. The left atrium is where it originates, and it tends to beat very fast, and it causes the patient to feel palpitations or fatigue or shortness of breath. Most of the time, it sort of tracks with age, so as we get older, more and more patients have it. Hypertension, sleep apnea, diabetes, coronary disease may contribute to it, but there are plenty of patients that don't have other traditional risk factors and just sort of have an electrical problem. The most common type would be someone who comes in and says, my heart is racing or skipping or running. They may feel a little lightheaded or short of breath, out-of-body type experience. There are plenty of other people, however, who really have no quote-unquote symptoms. They may go to their doctor, they may examine them, they'll hear an irregular heartbeat, get an EKG, and then document that there's atrial fibrillation. Those patients will come to our office a lot of times and say, I had no idea it was an atrial fibrillation. It puts you at about a 5 to 8-fold increased risk of stroke over someone who doesn't have atrial fibrillation. Many patients may present as their first symptom being a stroke, or they may have atrial fibrillation for quite some time that went unrecognized, and then all of a sudden develop a mini stroke or something like that. And so we definitely want to get these patients in the office, seen by us or their primary care physician, and get the appropriate medicines to reduce the risk of stroke. When someone comes to the office with atrial fibrillation, we discuss a series of treatment options, including medications, cardioversion, where you're basically trying to reset the heart, catheter ablation, and that's where we try to target some of the various short circuits in the heart, particularly in the left atrium. By trying to disconnect those short circuits, a lot of times that can restore sinus rhythm and offer the patient more relief than the previous strategy of medication or cardioversion. We will often take the conservative route, whether or not they choose an ablation or a medication route. We'll often keep those patients on blood thinners, simply because although the ablation can be very successful, it's not perfect. It doesn't cure people of atrial fibrillation because it's a progressive problem. So we would hate to take the patient off of blood thinners and then find out they've got more A-Fib. That's the time to see us, because if A-Fib comes and goes, then there's probably an 80% chance that we can fix that problem. It's the patients that have had A-Fib for years and years who have been kind of stuck in it. Those people will often not do as well with ablation, or they may require multiple ablations. But the patients who have A-Fib that comes and goes, we can generally help those patients the most.